Hi, my name is Lisa Cannada. I'm an orthopedic trauma surgeon at Novant Health and affiliated with the University of North Carolina Charlotte School of Medicine campus. Today, I'm going to answer questions about considerations when choosing a residency program. The first question is, what should I consider when choosing a residency program? Well, there's a lot of things to consider. First of all, do your homework. Read and learn about the residency program. Learn about the residency program from their website. Use the multiple resources available. For orthopedics, that includes Orin and also Texas Star, and social media is a great place. Another thing to consider, learning about the program. Also, look at the program carefully. Think about how you learn and if you'll fit in. Is it a large residency program where there might be 5 or more residents, or is a smaller program with 2 residents or 3? Residency size matters. You know how you learn and the type of environment you thrive in. Other considerations for residency program include the location of the residency. Do you need to be close to family for various reasons? What about the depth and breadth of cases? One thing that's really important is to look at the variety of rotations that the residents have, and also look and see if you have to go away. If you have a young child or a partner that might not be able to go away for a rotation that's required, you have to think about that. Look at the faculty, look at their experience. Is it a lot of people from the same program teaching you, or is it faculty from a variety of programs with diverse backgrounds and experiences? Those are some considerations when thinking about a residency program. The next question: which factors did you wish you considered when choosing a residency? I think it's really important when you're choosing a residency program not to choose a program based on the residents and faculty that are currently there. Someone could leave, there could be significant changes, especially with faculty and leadership. So don't choose a program for a person, choose a program for the experience. Another thing to think about is more than 90% of orthopedic residents do fellowships, and they do get the fellowships that they want for the most part. So you don't need to have a high reputation program the same way that you need to be thinking about when you're getting into residency program. So you don't need big names to get into fellowship. Your experiences during residency will help you get into fellowship and the contacts you make. It's a lot different and not as competitive as the medical school into residency process. The next question is, are there any questions you should ask programs when considering a residency? I think one question that's really important when you're talking, and you can add, and one thing to remember, in every interview room, you might be able to ask the same question and you might get different answers. They don't compare after the interview to see which question you asked. But questions to ask include, how much will you grow as a resident? How much autonomy is given in the operating room? At what level does one become autonomous in the operating room? Those are good questions to ask. Ask about the opportunities for growth to include not only your operative experience, but to include research opportunities, opportunities for leadership if that's your desire, opportunities to attend courses. Just think about what will help you in achieving your ultimate goals. Another good question to ask is, what did the residents do who left there? Where did they go? Did they all stay in the area? Did they leave and go across the country? Did some go into academics? That might help you in choosing a residency program. The next question is, what are some red flags in programs? Red flags in programs, before you even go to a program, there is a way to look up their ACGME status. Look up their ACGME accreditation status to see if there's any red flags, such as accreditation with warning or previous probation. Look at the ACGME status to learn about the program. Look at the pictures of the people in the program. If similar role models to what you look like are important, see if there is similar role models. Another red flag would be if there's high faculty turnover or if there have been residents leaving a program. Orthopedics is such a competitive specialty. To have residents leave a program could be a red flag. The last question is, what are positive qualities in programs that I should look for? I think one of the important things is the social events that come often with in-person interviews and even Zoom interviews. They try and do social gatherings. It's important to see how people interact and who is there and how everyone treats each other. You can really tell if someone's good friends if they get together outside of the residency, if they have each other's backs, if they know each other's family members, if they know each other's pets even. You'll get an idea of how close the residents are and the camaraderie. And to some, that's really important. It's especially important if you're in a residency in a rural area and there's not a lot of opportunities for other social interactions. So you want to get along with your fellow residents. You'll want to know that they're friends and that they have each other's back. Another thing that I look for as a positive quality is their alumni association. Ask if they have alumni get-togethers. Many of them have get-togethers at the American Academy of Orthopedic Surgeons meetings, but it just means they have graduates that are proud to be from that program and will be there to help you when you're looking for jobs, want positions, have questions, and they might even be your practice partners. Good luck.